All right, hello everyone. Now, I actually chose this picture specifically because it, for me, represented a lot of elements of our project. The project presented us with a bit of a dilemma because we wanted to address both education and healthcare needs, but do this in a very cost-efficient way, without at the same time sacrificing the quality of the clinical learning opportunities that students would have. So, in a sense, there was a numbers element, increasing the jars on the shelf. But to pick up a little bit on what Helen and Suzette said in a presentation earlier on, there was also a focus on feelings and experiences that students would have during this placement. So for me, this picture kind of captures a bit of a nostalgia about and my interest and love of older things. So it was kind of getting that experience through to students as well. So we know that education and healthcare providers do face challenges related to service demands and education placement requirements. And we know that 65-year-old people as a group in Australia are increasing and that they will continue to do so in the future. At the same time, we're also facing significant increases in student placement demands. So I've got some numbers on that slide. You'll notice that just in speech pathology, there's going to be quite a significant increase in the demand for student days, with it reaching close to 18,000 by 2016. That's all right. So quality clinical education, that's better. You should have said something. So quality clinical education opportunities are needed to ensure that speech therapy students will develop the skills and the confidence needed to provide services to older people in the future. This increasing demand for clinical placements is a challenge for us as educators, but at the same time it's creating new opportunities. So what we did as part of our project, in an attempt to meet all of these different needs and requirements, was to come up with an inter-service aged care clinic for speech pathology students that would go across both acute care and residential care. The project really would not have been possible without all of the different project partners, and they're listed on this slide, and one of the project partners are sitting in the audience. I won't embarrass her by pointing her out. But it was a partnership across a non-governmental agency, a university, and then public health, so Metro North. So what goals or objectives did we set for this placement? Well, firstly, we wanted to establish a new clinical teaching setting, and we wanted to establish new partnerships in clinical education that would result in increased student placement numbers and specifically learning opportunities within aged care. So it was important for us to set learning tasks and activities that would equip students with the knowledge and skills and confidence that they would need to be able to provide services in the future to older people. And lastly, we thought very carefully about the nature of the placement. So how could we structure the placement to ensure that it would increase students' interest in future careers in aged care? So there were quite a few considerations for us. We all know that one big challenge that we face in increasing student placement numbers relate to, at times, a reluctance to move away from the traditional one clinical educator to one student model. So for us, it was very important to implement a collaborative model. So there were always 3 students working collaboratively at any given point in time in their placements. Speech pathologists do work across a range of settings, so we wanted students to have an opportunity to engage in learning tasks across both acute care and residential care. In terms of the actual activities that they participated in during their placements, these were linked with the range of skills that they would need as future clinicians. So it included activities related to communication and dysphagia or swallowing difficulties. Because we know that communication disability do affect many older people's perceptions of quality of life, and that dysphagia potentially can compromise health and nutritional status. To match their learning that occurred in their clinical placements with what they would be required to do as clinicians in the future, we selected very specific client populations, and all students had an opportunity to engage with at least one client in each of these populations. And these populations were clients living with dementia, stroke, respiratory disease, acute delirium, as well as clients who presented as frail or medically complex. Now, in addition to this, all of our students had an opportunity to provide services to clients who were medically well. And then we structured the placement in such a way that there were specific readings that would prepare them for the given population that they would focus on in the coming week, and that just facilitated their learning. An appreciation for person-centered care or optimizing health outcomes was important for us to develop. So we had to think very carefully about the frequency and the nature of interactions that students would have with older people. Very often students who are on an adult placement in speech pathology, that is, might only have experiences within an acute hospital setting, and these encounters are often quite brief. And many of the clients who they would see might be quite frail or medically complex. Research indicates that interaction with healthy, aging older people play a very important role in positive attitude development for future employment in aged care. So in this sense, the residential setting was crucial in creating that consistent interaction with all the clients for the students. Just very briefly, again, as I said before, this was a collaborative project with these different agencies. We had support from a whole lot of different people, including the allied health directors from Redcliffe Hospital and the Prince Charles Hospital, Queensland, University of Queensland course coordinator, and the resident speech pathologist at Weller Gardens was crucial in the success of this project. All students had an opportunity in our project to engage in a crossover placement. And this was across both first and second semester, so 12 students in total participated in this project. And the actual supervision of students were done by Metro North and a University of Queensland clinical educator. So what did we achieve? Well, we did establish a new clinical training setting. It was also a novel approach to providing clinical education for speech pathology students within Metro North. New partnerships were created. 780 clinical learning hours were provided. There was definitely an increase in the access to speech pathology services in both of the settings. And then there were also a number of resources that the students developed, and what was good about the placement was whatever was developed by one group of students would just be handed over to the next group of students. So I just included 2 examples of resources, but they were across both dysphagia management and also focusing on increasing communication participation. And then lastly, we also set the goal if we wanted to increase students' confidence in working within aged care. And we've only really started to look at some of the results that we gathered from surveys. And just very briefly, if you compare the left and the right side of this graph, you'd notice that initially students had very little to no knowledge about a whole number of aspects of providing services to older clients, but that there was a trend towards an increase in this knowledge. a similar trend occurred when we looked at confidence in providing services related to assessment and management. What did the students say? So all of the students completed reflective diaries throughout their placements, and I just included just 4 examples of some of their quotes. And what came through from these diary entries were that they developed an appreciation for the uniqueness of older clients, the value that we as speech pathologists can bring, especially when we look at increasing communication participation, and also for how complex our services are across the different settings. Is it sustainable? Yes, we've already started discussions about continuing the placement, and it will actually continue in 2014 across the same services. And then just to wrap up, I feel the project demonstrated that collaboration between education providers, public health care and non-governmental services to create new opportunities for clinical education that is resource efficient and that can be very responsive to the changing healthcare context.